Module 2. Definition of a concussion. A concussion is an altered state of consciousness that results from a trauma. An altered state of consciousness is represented by any loss of consciousness, any loss of memory for events immediately before or after the accident, any change in mental status such as disorientation or confusion, or any focal neurological deficits. A focal neurological deficit is a problem with nerve function that affects a specific location, like the right arm or the tongue. Or it might affect a specific function like speech or swallowing. It is important to note that there does not have to be a loss of consciousness for the diagnosis of a concussion. As well, the neurological signs of a concussion rarely show on X-rays or a CT scan. The diagnosis of concussion is primarily based on signs and symptoms of the person who experiences the trauma. It is important for observers to record the signs and symptoms of the person so that a doctor can make the proper diagnosis. Concussions occur as a result of violent movement of the brain inside the skull. A blow to the head while the head is stationary will produce a concussion if the blow is severe. However, the majority of concussions occur when the head is the moving object and there is contact with an immovable object. The majority of concussions in schools occur from falls. Even in sports, concussions most often occur from the player falling and hitting the floor or ground or some other object.